What's up, everybody? It's
Lamar.
and Angela, and we are here on our channel to answer your questions about healthcare. So many of you have sent us private messages and had so many questions about what healthcare in Mexico is like. And so I thought instead of having to answer each of you individually, because a lot of the questions were the same, we would come on board to answer the question together and put this video together to answer some of these questions for you if you're thinking about moving to Mexico. Lamar and I are temporary residents of Mexico. We've been here for a year and a half.
Yep.
A year and a half. We live in a town called Querétaro, Mexico, which is located about 3 hours north of Mexico City in the heart of Mexico. Querétaro is a thriving town that is full of life and diversity. It's very modern, but also has a colonial feel to it. So it gives you all the modern amenities with the colonial charm. So we wanted to bring our experience of what healthcare is like, particularly in Querétaro, but also in Cancun, because I have done some medical tourism in Cancun. So you ready to answer these questions?
Sure. Yep, absolutely.
All right, so let's see what we got. First question, is healthcare affordable in Mexico? I have a coworker that tells me all the time that it's dangerous, but I wonder how accurate that is since he's never been there. Never been? What say you, sweetheart?
Is healthcare affordable in Mexico? Absolutely. It's absolutely affordable. We went to get eyes checked, glasses.
True.
Wasn't expensive at all. They made.
Now, what do you define expensive? Because maybe that's the.
In the States, when we went to get glasses were, if I'm not, it was $350.
Oh,
750.
Yeah. It was
350, 375.
Yeah.
For a pair of glasses.
For those 2 pair of glasses, it was, yeah.
For
plus the eye exam
and all that.
It was running close to almost a little under $1,000 for 2 pair of glasses.
Right. Here in Mexico, glasses for our son and daughter.
Oh, right. That's true. We did that for both of them.
Was I think it was 1,200 pesos.
Yeah.
Which works out to be about what is 1,200?
I'm about to look it up to find out because I still can't do the math quite correctly in my head off the top of my dome. But 1,200 pesos is $67
for 2 pairs of glasses and the eye exam.
2 pair of glasses with prescription glasses.
Yes, these weren't. They had to send out and had the glasses made. It wasn't like they took some glasses or readers off of the shelf.
With frames that the kids picked out.
Yes.
Right.
So, no, it wasn't expensive at all. Benjamin had some ear surgery.
Oh, right.
That would have cost anywhere between $15,000 to $20,000.
$1,000, yeah.
It was $2,400 here.
And that was staying in a private hospital, private suite, and being able to, that also included the x-rays, the doctor's visits, the follow-up visits, the whole kit and caboodle.
Even the doctor providing her own information so that we could contact her if there was any kind of complications.
Right.
And she called to check on him after the surgery. So
not
expensive at all.
Right. So I would say healthcare is affordable, especially in comparison to the outrageous expense of healthcare in the United States. So
So the other part of this question, I'm not sure exactly what they mean by dangerous.
And I wouldn't even take the advice of somebody who has never been to Mexico. Okay.
Right.
Stop taking advice from unpassported people, please.
Yeah. Dangerous. I'm still trying to. Dangerous how? Like they're quacks that they're using
I'm not sure.
leeches or something. They've got some rusty saws.
But you
what?
But you always have to take that into consideration when I'm hearing advice from people telling me about how dangerous it is, but they've never been there. Okay, tell me about that if you've been there and you have some actual experiences to report back. But your friends, cousins, sisters, best friends, next door neighbor, and all that kind of stuff. Okay.
Dangerous. Wow.
Okay. Yeah. All right. You gave me the next question.
Angela, you have such a beautiful smile.
Oh.
Have you been able to find a good dentist in Mexico?
Okay, I have located several good dentists here in Querétaro. I will report back on my experiences going to said dentist, but I did have some medical tourism that I mentioned earlier in Cancun. I had to have 2 root canals. Well, it turns out I only needed one, but 2 root canals, and got priced for them when I was in the States. They quoted me a price of $15,000, and we had insurance.
Yes.
Okay, $15,000 to do my root canals, and I said the devil is a liar. Okay, so what? By that time, I had also heard from other people that you can go to other countries and get good health care, good dental care done relatively inexpensively. And at that time, I was finishing up my doctorates, and I needed some downtime to do some intense writing of my dissertation. And so I wanted to combine a medical tourism trip with a writing dissertation kind of sabbatical type of trip. So I had 10 days, came to a place in Cancun. I will put their information either in the description box below of the company that we used, that I went to. I I'm not affiliated with the company. Don't get any kind of anything for the company. Can't attest for how they are at now. But when I went to this particular company, again, the information will be below. They did a fantastic job. Did a fantastic job on my root canal. As a matter of fact, I had a root canal, my very first root canal I had done in the States. I can always look at that tooth and tell that it's not, the crown was not done. The color is off. I can look at it and tell. The one that they did here in Mexico, chef's kiss. It matches my teeth perfectly. The artistry that they demonstrated in terms of getting to putting my mouth or my tooth, uh, doing that work was just fantastic. They picked me up at the airport, took me to my hotel, state of the art facilities, etc. They gave me just tremendous, wonderful service. Pay the hotel, airfare, food, the dental service, which turned out to be $750. All of that came to 2,500 for the fraction of a price. 15,000, 2,500. So was it worth it? Absolutely. Would I do it again? Absolutely. And I have to have another one on this side of my mouth. And so I will be documenting that process, going back to the same place because they did such a fantastic job. I want to go back again and have them to do the tooth that's down here on the bottom. So I had a wonderful experience and can't complain.
Cool.
Ready for the next question?
Yeah.
Okay. All right. Do you have health insurance there? And will doctors in Mexico take your US insurance? No, right now we do not have health insurance, because pretty much we've been able to pay out of pocket, and the amount that we pay out of pocket for the entire service
is sometimes almost less than a copay.
Yeah, is less
in the
than
United States.
In the United States
Yeah.
that we would have paid previously. So it's kind of, it hasn't been that type of an issue. However, we are in the process of looking for health insurance, and we'll probably document that process as well in terms of looking for catastrophic type health insurance.
Right.
Will doctors in Mexico take your US insurance? Probably not. Most of the time, from what I have seen, they don't take US insurance, or your US employer won't, or your US health coverage doesn't stretch all the way down here to Mexico. If there's some sort of, now depending on your policy, if you have some sort of plan that does allow for out of network visits and they consider being out of the country out of network, that might work for you in that instance. Or if they may cover you if you're on vacation. our dog. If you're on vacation and you have or are in need of emergency health care, your medical policy might stretch that way. But from my understanding and what I have seen, they have not covered. U.S. health insurance doesn't stretch down this far.
No. Hmm.
Okay.
Yeah.
Okay. Next one. Richard.
I take many prescription medications. I'm afraid to move abroad because I may not be able to get my meds there. Any advice? First of all, a lot of meds here don't require a prescription.
Right.
Depends on what you're getting.
Yeah.
And usually the pharmacias here have many of the medications that you're looking for
that you can buy over the counter. Yeah.
So depending on what the meds that you require, you can check to find out if they are available here in Mexico. I'm not sure if you can check and do a search. Maybe you can. However, if you go to a pharmacia here, walk up to the counter, have your bottle of medication that you normally use and give it to them. If they have it, they sell it right over the counter.
Right. And without a prescription, sometimes we've been able to walk up to the counter and just give the name of the medication that my son needs or my daughter needs and get the prescription right there over the counter. Most of the time, it's been for a lot less than what we would normally pay in the States. Some of the medications that one medication that my son uses and has is what we would consider pricey, and that ranges like $60 for a month supply, or 20 days, 30 days supply, right. 20 days supply. That's pricey here. So, taking many prescription medications. Now, I also will say, living in Mexico, there's a lot about our health that has generally improved. So I didn't take many medications or didn't take any medications prior to
Neither did I.
Us moving here. However, I do feel like my health has improved.
Yes.
Just by the food that I'm eating, the fresh vegetables, the fresh fruit that we're eating each day. Querétaro is in an area that the sun, it's
up by 9:30 up high.
Yeah, it's like eternal spring here. So we're able to get out and exercise every day, get out and walk or something like that, to do a lot of walking, things like that. So I feel generally healthier than I have felt in a long time. And as a matter of fact, we both
have lost weight
simply because we were here and weren't even trying.
Right.
I mean, we going to the bakery on the corner, eating pastries every morning with our coffee.
Aren't as sweet. They don't use as much sugar. So that helps a lot.
Right. So I wouldn't be afraid to move abroad just because of the medication factor. Don't let that stop you. If you want to move abroad, I would say go for it.
Right.
Definitely go for it. The area that you'll be trying to go to or move to, do a Google search on what the pharmacies are. You can maybe perhaps look online to see if that pharmacy offers the medications that you use.
Yeah. Yep.
Yeah. Okay. Next question. Are the hospitals and doctors' offices modern? Yes.
For sure. When Ben had his surgery, we were brought upstairs and taken into a room, which we're like, okay, what room is this? But it turned out that was the room for us to wait for him. They prepped him in that room, got him ready, and then we thought once they took him out of the room, we would have to leave. They said, no, you stay here.
Mm-hmm. We were like, oh, stay here in this private room?
Right.
Oh. They gave us the remote for the television, gave us the remote for the air conditioning.
Yeah.
Make yourself comfortable.
Right.
We'll let you know when we're finished. We'll bring him back down to the room after to recover in his suite.
With regard to being modern, state of the art facility. I mean, in this hospital, it was brand new, and most of the hospitals that we've gone into
here in our town
are either new, been built recently. As a matter of fact, the large hospital here is in use and still under construction. So it's a beautiful a hospital,
Mhm.
modern facility. Um, Unlike what you hear, the propaganda or whatever, developing country. Yeah, they're developing, but it's not like you think they're developing. They're developing like any other country would with their modern
Just like the United States.
states. I mean, they use all of the latest IT equipment, technology here.
Yeah.
Yeah, it's very modern.
Very, very modern. So we've been very pleased with our whole experience. And as a matter of fact, we've been so pleased. The doctors will give you their cell phone number.
Contact you,
They
contact
will
WhatsApp.
tell you to call them if you have any questions.
Even many
They
of them do house calls.
make house calls here, y'all. House calls will come here to your house to check you out. Unheard of.
Right.
Unheard of.
Exactly.
There's last month was October. October was Breast Cancer Awareness Month. They were offering a special at one of the local hospital facilities that will get you checked out, all of your lady parts from the rooter to the tutor. Will check all of that, mammogram, MRIs, all that kind of stuff, and the price uh, was like 700. I think it was 700 or 800 pesos, which
It's like $67 US.
that's mammograms, y'all.
Mhm.
The whole experience, the whole checking up everything for $67. You can't beat that.
No.
You can't beat it. So
If you've ever watched the movie The Hangover, in the second one, I believe, one of the guys gets injured and he comes out and he gets fixed up and he goes, "It costs $7. How is that possible?"
yeah,
Which is funny, but
it's
that's
possible because it's not in the United States. And as a matter of fact, some of the persons that we've seen or that we've gone to have been very gracious in terms of payments and all that kind of stuff.
Oh, yeah.
They will work with you,
Yeah.
and not against you, or what have you. So you want to tell them about how they get their doctor's license?
Oh, they start school, go to college, they go straight in, straight in. It's not, you do pre-med. It's parallel. You do your basic courses along with your medical school courses, and you start doing not just an internship, but basically as an apprentice, as a hands-on person. You start off with minor things and
And you
work your way
learn with the doctor,
with
with a
the
skilled doctor. You work under that other doctor.
It's not like the United States where you just stand there and observe and watch.
Right.
Okay, but you actually are practicing from Jump Street.
Right. So that's been an interesting dynamic, but very useful.
Do all the doctors speak Spanish? Are there any English speaking doctors available? Yes.
Yeah. Well, not all the doctors speak
yes,
Spanish.
Spanish. Some of them speak English, but a lot of them, like the surgeon for Ben, she spoke English.
Yeah.
And her English was very good.
Yeah, she kept saying, "Oh, I'm sorry. I apologize for my English." And I'm like, your English is fine. We can understand what you're saying. Yeah. Okay. Yeah. Many doctors speak English.
As a matter of fact, she told us that the medical books are in English, so they have to read it in English. So they're learning English by studying medicine. Now, as far as them practicing speaking English is a different story, but she spoke very good English.
Yeah. Are there English speaking doctors available? Yes. And last question. How much does the average doctor's visit cost? Can I use my current health plan from my employer? I work remotely in the US. Okay, how much does the average doctor's visit? Now, that's funny that he should be picking this dog up because we should even talk about the vet visits too.
She had surgery recently. She had a
little fatty tumor on her chest and one behind her neck.
Shoulder.
Yeah.
And when we got the bill, it was 1,000 pesos.
Right.
It's like $55, $60.
I'll tell you what 1,000 pesos is. 1,000 pesos is 1,000 pesos is $56
for the surgery.
For surgery. For the dog.
For the
The
dog.
visit, the examination, all of that. And the follow-up.
In the United States, this would probably cost $450, $500, maybe a little bit more.
For the surgery?
Because Lucky had one removed, and it was how much?
It was over $1,000.
Oh yeah.
That was $1,000.
$56. Medication, exam, and then the removal of the stitches.
Mm-hmm. Yeah. So even for the dogs, we've gone to and had I've gone and had I went to a dermatologist visit. That copay was I want to say that copay was like 200 pesos or so.
That's nothing.
Yeah.
She had eye surgery for.
Oh, that's right. I had my eye surgery. Mm-hmm.
Yeah.
Yeah. 200 pesos is $11.
Right.
$11 for
Right.
that average for that doctor's visit. My eye surgery, I can't remember how much my eye surgery was.
Right.
But it wasn't. It was definitely was under. I would probably say on the whole visit to include the both exams, the follow-up exam, all of that. I would dare say the whole thing. I would be surprised if it came to more than $300 for surgery in a state-of-the-art facility.
Right. Exactly. Now, as far as your current health plan from your employer, probably not.
Probably not, because most now, mind you, when I've been shopping for insurance, and we've been in the market shopping for insurance because we want to have some sort of want insurance for catastrophic type events. But as we've been shopping, we have found that the price is significantly different for health insurance when you consider having coverage in the United States. It's like if I choose to have health insurance to cover me in Mexico and anywhere else in the world, it's this. But if I add in the United States, it adds in that. The cost is astronomical, and that's because it's expensive to get healthcare in the United States.
Yeah.
It's out of control. Healthcare costs are out of control. And so that's why it's cheaper for us here in Mexico just to have an insurance policy that covers us when we're in Mexico and the rest of the world,
right,
and not in the United States.
Exactly.
Now, we could possibly, because of Obamacare and things like that, we could get a inexpensive policy to cover us for when we're in the United States. And that's what it's November. So we're in the process of doing that right now so that our son, who's in college, can have coverage, healthcare coverage while he's there in the States. And we won't have to worry about him breaking another leg or something like that.
Right.
So, okay. And I think that's it. Those are the last of our questions. See, this is short and sweet. We are in and out. We want to again thank you guys for subscribing to our channel. And if you haven't subscribed, what are you waiting for?
Yeah.
We answer questions like this about our experience of moving to Mexico from Maryland to Mexico.
You can subscribe for this one right here.
This cutie right here. They can't see. Look at this face. Look at this little chihuahua face. She's looking at me like, I don't want to be on camera.
She doesn't like cameras.
But we want to encourage you. Thank you for subscribing if you've already joined our family. And if you haven't, what are you waiting for? Again, what are you waiting for? That link is below for the medical, the dental tourism place that I went to, as well as, you know what else is below? The like button. Like this video.
And subscribe.
And subscribe if you want to have more content like this from expats with boots on the ground. And if you would like for us to go check something out here in Querétaro and want to reach out to us, our contact information is in the link box below as well. Okay? Bye.
See ya.